In this video, we will discuss the most important thing you need to know about cervical cancer. Welcome to Health Academy. Health Academy is a channel that shares tons of knowledge about all aspects of health, including wellness, beauty, diseases, food, and other related topics. If you're new in this channel, make sure to subscribe and click the notification bell because we upload multiple contents every single day. We also publish full online courses and advanced master classes in our channel for free. So without further ado, let's jump right in. Cervical cancer is one of those cancers that only women get. You will want to be screened to make sure you don't have it. Here, you will learn about some of those screening methods and what to expect. Learn about what cervical cancer is, ways to help prevent yourself from getting it, and what the survival rate of it is if you do get it. What is cervical cancer? The cervix is the lower part of the uterus. Most cervical cancers begin in the cells that line the cervix. The normal cells of the cervix slowly develop into precancerous cells. It takes time for the precancerous cells to turn into cancerous cells, and this is why it's so important to get regular screenings. Screening for cervical cancer. There are two tests which are performed to screen for cervical cancer, a Pap smear and an HPV test. The Pap smear tests for precancerous cells. The HPV test looks for the human papillomavirus, which can lead to cancer. The Pap test is recommended for women ages 21 to 65. It is done right in your doctor or gynecologist's office. A speculum, a metal or plastic instrument, is placed inside the vagina and used to widen it, and then a few swabs are taken and tested in a lab to make sure they are not abnormal. The HPV test is done similarly, but the lab will test for the human papillomavirus. The new recommendations from the American College of Gynecology (ACOG) is to have a Pap smear performed every 3 years starting at the age of 21. If you are at higher risk, meaning you have had precancerous cells in a prior test, then your doctor will recommend more frequent screenings. The Pap test is the most accurate screening test there is for cervical cancer. It does not detect any other gynecological cancers, though, so for any abnormal symptoms you should see your doctor. Aside from regular screenings, you want to make sure you're doing all you can to prevent yourself from getting cervical cancer. How to prevent cervical cancer? Getting screened is the most important thing you can do in preventing cervical cancer. However, beyond that, there are some other things you can do as well. Since HPV can cause cervical cancer, getting the HPV vaccine will help prevent you from getting cervical cancer. Beyond that, eating right, not smoking, not having lots of sexual partners, and practicing safe sex, using condoms, will help prevent you from getting cervical cancer. HPV is a sexually transmitted disease. And while HPV can live on both the male and female genitalia in areas which are not protected by a condom, using a condom has been shown to lower the chances of transmitting HPV and getting cervical cancer. All of these steps will help prevent you from getting cervical cancer. Getting cervical cancer. In most instances, it takes a few years for precancerous cells to turn into cancer cells, and most times that doesn't even happen. This is why it's important to have regular screenings so you can catch the cancer early, because that's always your best chance. There are many factors which will weigh in on your chances of survival with cervical cancer. These include type of cancer, stage of cancer, age, and overall health, and if the cancer comes back after treatment. The further the cancer spreads outside of the cervix, the lower the chances of survival. So again, this is why screening is so very important to catch it early. It is completely reasonable to assume that you will survive 5 years or more after being diagnosed with cervical cancer. If you have any comments, suggestions, and reactions, let us know in the comment section below. We will be posting more videos about these topics and other contents related to health, so make sure to subscribe. If you like this video, give us a thumbs up to help our channel grow. See you in our next videos.